Welcome everybody, I'm so glad to be here to talk about Lip Volumizer, a product that I really love so much, so thank you Contrad Swiss for giving me this chance. Let me introduce myself. My name is Annalisa Forni. I'm a medical doctor and since 2K12 I am an aesthetic physician. I got my master's degree at Agora, Society of Aesthetic Medicine in Milan in 2K19. Since 2K20, I am the CEO and founder at the Dottoressa Forni Medical Center, my own clinic in Italy. And currently, I am the KOL Italy for Contrad Swiss. So let's start talking about lip fillers. What is a lip filler? It consists in hyaluronic acids injections for lips volume augmentation or just to define the contour of the lips, and is a treatment that lasts about 6-9 months. It depends on the characteristics of the patients. How I do it? So my technique is apply a topical lidocaine cream 1 hour before the treatment, and this can help to gain pain reduction and to make the treatment more comfortable for the patient. I usually choose low medium G prime fillers. These can help me to have more natural effect. I use a 30G per 13 millimeters needle, and I prefer to use a vertical technique instead of horizontal technique, but I always inject in the superficial layer. How to do it, why to do it? Well, because immediately after we can see a volume improvement, a lip contour definition, symmetry recovery, and we can restore the upper-lower lip ratio. But what can we see after a few weeks, usually 14, 20, 21 days? We can see the improvement of hydration, softness, elasticity, and we can have really good harmony and balance. But what to do before a lip fillers session? The week before, I usually suggest patients to apply Lip Volumizer twice a day, starting at least 1 week before the procedure, but the best is to start the application of LV 2 weeks before. 1 hour before the treatment is so important to apply an anesthetic cream. Why? To have less pain during the treatment and to make the treatment more comfortable for the patient. During a filler procedure, we can have challenges that could be a little bit hard to manage. So let's see what the challenges are. The first is burning, especially with no lido fillers. When we use fillers that don't have lidocaine in the vials, patients feel really high level of burning during the treatment. The pain during injection is due to the needle and is due also to the fillers during the injection itself, and the patient feels a little less pain if we can apply 1 hour before the treatment an anesthetic cream. The post-injection swelling and edema, it depends on the characteristic of the patients and the characteristic of the filler that we are going to use during the procedure. Stiffness after injection. And the last one is dryness. Let's focus on dryness. Dryness can be a patient trait, can be consequent to the application of anesthetic cream and dryness is the result of the skin disinfection before the treatment. So let's see some examples of dryness before the procedure. It can be really hard to manage, and LV can be so helpful to manage dryness. What were my needs? My needs were to improve elasticity both before and post treatment, to reduce dryness before the treatment, to counteract post treatment dehydration due to anesthetic and disinfectant, to decrease recovery time, and why not, to enhance fillers performance, having more plumping effect and long-lasting results. So why Lip Volumizer? I choose Lip Volumizer. I like it, I love it because it has a non-sticky texture. It's really easy to use, and for its composition, the hyaluronic acid, hydrolyzed collagen, and the oligopeptides. Why oligopeptides are so important? They are derived from collagen, such as SH polypeptide 47 derived from col1A1. They activate collagen signaling pathways, so we can really stimulate the production of collagen in the extracellular matrix. How to use LV? Well, I share to you my experience. Immediately after the treatment, I simply apply a small amount all over the lips mucosa, but I leave it on for about 2 minutes, and then I gently massage until complete absorption. While the daily routine at home consists in a twice-a-day application for at least 2 weeks, but in my opinion, it's better to apply Lip Volumizer after the treatment at home for at least 1 month. What are the feedbacks about LV from me and my patients? So, immediately after the filler, it reduces burning, dryness, and redness in a few minutes. After daily use at home during the first 1-3 days, the patient can experience less pain, discomfort, and stiffness, so we have a downtime considerably shortened. While after a long-term use, we have an improvement of elasticity, softness, and hydrating action of hyaluronic acid, plus the long-lasting and really more natural result. Here are some examples, 2 examples of before and after lip fillers with and without LV. So let's have a look. In the first photo, obviously, we have the situation before the procedure. The second photos, we can see that obviously we have more plumping effect, we have more defined contour lips, but we still have dryness, we still have skin exfoliation. In the third photos, we can see the plumping effect, we can see the contour defining, yes, but what we can see, what is the real difference, is the hydrating effect, is the moisturizing effect, the softness that we can see even only in a photo. We can see that we have no more exfoliation, and the situation has turned to this point only 2 minutes after LV application, and you can also appreciate the important reduction of the inflammation. I repeat, only 2 minutes after the LV application. That's incredible. So, what's the take home message? Twice a day application starting 1 week before improves elasticity and hydration, reduces dryness, and facilitates the filler injection. Immediately post procedure application counteracts side effects. Long term daily use increases and prolongs the efficacy of hyaluronic acid injections. And so, we should, in my opinion, insert Lip Volumizer in every filler protocol, both before starting 2 weeks before the procedure, and we should insert Lip Volumizer during the procedure. But we have also to suggest the patient to use Lip Volumizer at home as a home care product for at least 1 month to have a long-lasting result, to have more natural results, and to have so satisfied patients. So thank you for being here with me. I hope that this webinar will be useful and helpful for you. I thank you. Thank you so much, Contrad Swiss, for giving me this chance. And if you need any kind of information or any kind of help, you can contact us. So thank you again and see you next time.